Hello, it's Dr. Jared Reading again with the Uvalde Health Authority. We've been having a lot of businesses, what I call panic testing. What happens is they have an employee who tests positive and then they want to send all their employees to the doctor's office or to the hospital to get tested, quote, just to be sure that they're going to be safe. I want to stress that that's going to cause more spread than it's going to solve, okay? So what to do if an employee tests positive at your facility? Having done a lot of contact tracing, I can tell you that if you're doing it right at your business, meaning you're making more masks, you're doing social distancing, it's not being spread there. So that's the first thing to keep in mind, is that if you're doing it right, you're gonna have very low, if any, transmission among employees. Most people are actually safer at work than they are at home when they go home with their family who's been out and about with who knows who. So, all right, so you have an employee test positive, I test positive, what do you do next? First thing you do is you're going to assess their exposure to other employees. So if they will be honest with you and tell you, yes, I did not have my mask on and I was talking to other people, then anybody who around them who didn't do it right, and if they didn't do it right where they didn't have the mask on, if they were around that employee 2 days before the employee developed symptoms until you sent the employee home, those people need to be quarantined for 2 weeks, regardless of what a test shows. The reason why is because you can test negative, and if you don't have symptoms, your load, the amount of virus you have, is actually going to be so little, you might test negative when you're really positive. So if you have someone without high risk exposure, they just need to go home for 2 weeks, and they can get tested if they get symptoms. But if they go get tested, I don't care what the test shows, they still need to stay home for 2 weeks because they're not going to be safe to work around your customers. That's the first thing, is this. Don't assume that they go get tested, but maybe they can come back to work. The next question I get a lot is, how long do they have to stay out? Can we retest them all the time? I want to retest my employee to make sure they're safe before I come back. That's not necessary. They've already done the test to show that if somebody has been fever-free for the last 3 days of their illness, and it's been more than 10 days since their illness started, and there are other symptoms, whether it be their malaise, their cough, their sore throat, if the other things are getting better, they don't have to be gone, but just getting better, they're not contagious anymore. So you don't have to say, well, I'm going to test them a bunch of times to make sure they come back. You can just say, it's been 10 days, no fever for 3 days, and your other symptoms are improving, you're not contagious. Now, they might still feel pretty weak and might not be able to work. In that case, let them stay home. But if they have a job where they can still work, even with some minor symptoms left, they can come back and work for you. They're not considered contagious anymore. So the rules to go by are 3 days, no fever, 10 days since start of symptoms, other symptoms getting better. That's when you know they're not contagious anymore. So that's when you can let them come back and you can work. Still make them wear masks, because there are some reports of people catching this more than once now. We think that's more the exception, not the rule, but just still have them work with social distancing in a mask for their own safety as well. Now the questions. I have a lot of people very concerned about, well, my brother's friend was over and his sister tested positive and they were around each other, so should I quarantine the whole office? The answer is no, you don't have to. So the way you decide to quarantine or send somebody home is if they've had that exposure. A high risk exposure is 15 minutes or longer within 6 feet of another person if they're not masks, and if the other people aren't wearing masks. So if your business is doing it right, where you're making your employees wear masks, where you're cleaning high touch surfaces, so surfaces like doorknobs, things like that, frequently you don't have to send employees home, quote, just to be safe. That's not necessary unless they have actually had the true exposure to a known positive or a person who was sick with COVID. So if you want to, because that's just your business and you want to be extra careful, that's obviously your choice, but it's not necessary. So 6 feet or less, within 15 minutes or more, that's when you send them home around somebody who definitely has had the disease. So for example, a true family member they've been around at home or they're taking care of them, absolutely send them home because they've been living with that person and yes, close contact. But a brother, sister, 2 people removed, 3 people removed, you don't have to worry about that so much, because again, there was no direct contact. It's 2 or 3 contacts removed, and incubation periods and other things come into play that we know that it's the direct contact, 15 minutes or more, 6 feet or less, no masks, that you're going to have to start sending somebody home. If you have an employee if they have an employee come to you and say, hey, I'm not feeling too great, thank them. Say, thank you so much for letting me know. Go home, go see your doctor, maybe get tested so we know where to proceed from there. Because if they tell you that, that's gonna, and recommend they get tested, that will tell you what to do with the rest of your employees if you have an employee come to you that way. So encourage your employees to let you know when they're not feeling well. The symptoms are pretty well known now. They're all over the website, easy to see. We have a lot of community transmission, so please be safe. Please do it right. Keep your employees safe. But again, if you have any questions, you're always welcome to contact your local health provider, and we can walk you through it. More questions, you can find them on the cdc.org or cdc.gov site. umhtx.org site has a lot of information on there as well for employers. And then UvaldeHealthAuthority.org has links to those other websites. But again, mass testing your employees based on one exposure is going to hurt your business more than it's going to help it. So take the time, assess the risk of your employees, and then send them home based on that, regardless of what the test shows. That will keep your business safer, is to look at that. Again, 15 minutes or more within 6 feet, no masks, around a known COVID positive person, that person should go home for 2 weeks, regardless of what the test shows.